Hi everyone, I'm Madi Smith. Welcome to Unequal Access, Exploring Healthcare Financial Hardships in West Virginia. This project hits close to home for me. I work with insurance every day in my job, and I see firsthand how frustrating and confusing it can be for patients when things like coverage denials or prior authorizations get in the way of care. But even though I'm familiar with the process side of insurance, I realized I didn't fully understand the financial side of things, like how much care actually costs, what people are paying out of pocket, and what's happening across the state when insurance doesn't go far enough. So for my capstone, I decided to dig into that. I wanted to understand the real numbers behind the hardship, especially for West Virginians who are technically insured but still struggling. So in this project, we'll go over comparison of West Virginians' healthcare affordability to national averages, an analysis of financial hardship experienced by insured West Virginians with a focus on Medicaids and PEIA, which is the Public Employees Insurance Agency, findings from the U.S. Census Bureau, state Medicaid reports, and PEIA financial data. And then finally, we'll do some suggestions for provider level solutions to reduce preventable denials and improve outcomes. So, first things first, the problem is coverage isn't cutting it. Over 285,000 West Virginians live in poverty. More than 100,000 are uninsured, many stuck in the coverage gap. PEIA ran a $27.2 million deficit in the fiscal year of 2023, and what's more alarming is 64% of West Virginians reported at least one healthcare affordability burden in 2023. That's nearly 2 out of every 3 people. Skipping care, delaying treatment, or rationing medications. Medical debt and delayed care are common, even with active coverage. Unfortunately, coverage doesn't equal protection. So, how many West Virginians are struggling? This chart shows that more than 285,000 people in West Virginia live below the poverty line, which is about 1 in 5 residents. And it's not just one group. This includes children, working adults, and senior West Virginians. Financial vulnerability in this state affects every age group. Let's break that 285,000 down further. Over 87,000 are children. That's thousands of kids in households where basic needs like food and medicine are often out of reach. More women than men are in poverty at over 159,000, but men coming in at 126,000 are statistically less likely to seek preventative care or mental health help. That combo, poverty and poor access, can lead to serious untreated conditions. Now here's where it overlaps. According to the U.S. Census Bureau's 2023 American Community Survey, over 58,000 uninsured West Virginians are men. More than 11,000 are children that are uninsured, despite programs like CHIP, which could be a result of falling through the enrollment cracks, not qualifying for CHIP or other Medicaid plans due to family income or Medicaid unwinding, which we'll get to a little later. While women make up the largest share of those in poverty, they also face high uninsured numbers. This shows us that even the state's safety nets are leaving too many people behind. 13.3% of West Virginians, about 236,000 people, have medical debt. But debt isn't the whole story. In 2023, a survey by Altram's Healthcare Value Hub that included over 1,100 people found that 64% of residents, nearly 2 out of every 3, reported at least one healthcare affordability burden. This includes skipping doctor's visits, delaying procedures, rationing out medications to make them last longer, or struggling to pay medical bills, even with insurance. That means someone can be insured, not in collections, and still be drowning in cost. It shows just how fragile the system really is. One unexpected bill, denial, or delay can tip someone into financial crisis. So where does West Virginia stand against national averages in healthcare? There's a common assumption that because West Virginia has lower housing and living costs, that healthcare must be cheaper too, but that's not the case. According to the Bureau of Labor Statistics, the average American household spent $6,159 on healthcare in 2023, but in West Virginia, where healthcare costs about are about 16% higher than the national average based on Merrick's Healthcare Cost Index. That jumps to an estimate of $7,142 per year. That's nearly $1,000 more annually, and it's not happening in a state where it's happening in a state where incomes are already lower than average. So at this point, you might be asking yourselves, why is healthcare so expensive in West Virginia? While the data in this project only covers some Medicaids and PEIA, after some research, I have a few answers. We have some of the highest rates of chronic illnesses in the country, like diabetes, heart disease, and obesity. We're also one of the most rural states, which means fewer providers and higher travel costs. Add in the fact that we have the second oldest population after Maine, and many jobs don't offer health insurance, and it's easy to see why these costs add up quickly, even for people with coverage. In 2023, nearly 1 in 4 West Virginians were on a form of Mountain Health Trust Medicaid, but that's not the full picture. It doesn't include CHIP, CareSource, Standard West Virginia Medicaid, or other plans serving vulnerable residents. In total, over 688,000 residents relied on state-funded insurances last year. And yet, denials, delays, and gaps in care still hit thousands of these members. It shows that having insurance on paper doesn't always mean having access to care. On our second chart, we can see that over 1 million people are uninsured or have private insurance that don't have public records. From our previous slide about the overlapping crisis, thanks to the U.S. Census information, we know that about 114,000 of this number is uninsured residents. Here's what happened after continuous coverage protections ended post-COVID. It's called Medicaid unwinding. Enrollment dropped sharply in every major plan, which includes Unicare, now known as WellPoint, Aetna Better Health, and the health plan, especially between May and November. And these weren't all ineligible people. Many lost coverage due to missed paperwork, confusing re-enrollment instructions, or simple lack of notice. That's thousands of people losing access, not because they didn't qualify, but because the system failed them. So when we think back to those 11,000 children that were uninsured at the beginning of this presentation, it all starts to fall in place where the gaps are. Let's take a look at PEIA, the Public Employees Insurance Agency. On paper, it's a benefit, but the members paid an average of $10,608 in 2023, while the U.S. average was $6,159. Even though PEIA members spend less than the national average on medical and prescription services at $2,640, it's not enough to offset the massive insurance costs. So next we move to legislation with consequences. What Senate Bill 268 changed. In July of 2023, Senate Bill 268 reshaped PEIA coverage. It reinstated the 80-20 premium split, pushing more costs onto public employees, added a spousal surcharge, making it more expensive to cover family members, increased provider reimbursement to 110% of Medicare, adding $54.4 million to claims costs. And PEIA ran a $27.2 million deficit in the fiscal year of 2023, requiring $52 million in state transfers to stay afloat, a sign of deep instability. These changes raised members' costs while doing little to fix structural financial issues and did nothing to reduce denial risks or improve access. Then we have Senate Bill 267, Medicaid's portal push. State policy changes now require most prior authorizations to go through insurer-specific online portals, a shift tied to West Virginia Medicaid modernization efforts. Faxed or verbal submissions are often no longer accepted, leading to higher denial rates when providers aren't properly trained or equipped. Rural clinics and understaffed offices struggling the most, creating delays in care and more rejected claims. The change was meant to streamline care but has added technical hurdles that disproportionately hurt vulnerable patients and overworked staff. So, what are our provider level solutions, turning insights into action? We can train front office staff on portals, prior authorizations, and shifting insurance rules. We can hold monthly meetings to review updates and denial trends. We can build a payer playbook with portal links and checklists. Flag coverage issues early during patient intake to avoid denials. Partner with social workers to assist in Medicaid re-enrollment and appeals, and promote preventative care to reduce costly avoidable claims. These are a few of my resources I used during this project. So in conclusion, when we talk about coverage in West Virginia, we can't stop at whether someone has insurance. We have to ask, is that coverage actually working for them? Because right now, too many people are falling through the cracks, skipping care, rationing medications, or getting buried in bills, even when they're covered. This project made me realize that the problem isn't just the system, it's how hard it is to navigate the system, especially for rural patients, working families, and overworked providers. There is no simple fix, but we can do better through better training, better outreach, and better communication. If we want people to trust that the healthcare will be there for them when they need it, we have to make sure that the coverage means more than just a card in their wallet. Thank you.